Hi guys, welcome back to Biology with Mary-nyosk. If you're new here, you're very welcome. If you've not subscribed, make sure you subscribe today. Turn on the notification bell so that you can be notified whenever I upload a video. From the title, we are going to discuss how to treat COVID-19 from home. And today I'm going to share with you the tips that you're supposed to use in order to treat yourself or to treat a family member or a friend from COVID-19. So guys, you can be a nurse from home. It's not hard. Be ready to learn. So the first thing, when you realize that you have the symptoms for COVID-19, first of all, you have to isolate yourself for 1 week. Isolate yourself in a room, maybe your room or an office or an extra room that is around where you'll spend most of the time alone. That's what isolation means. Be alone. Do not interact a lot with the other family members or your friends. Then, that period of isolation, it's going to help you be sure if that person is infected by COVID-19. And since most of the people are asymptomatic, meaning that someone can be infected with COVID-19 but one cannot tell. But these asymptomatic people can easily transfer the infectious agents from one person to another if you fail to isolate yourself. The purpose of isolation is to prevent the COVID-19 infection from spreading to other people. Also, it's going to help that person to treat themselves and to see whether the infection is serious so that they can rush to the hospital, and if it's not serious, they can cure it from home. But to start with, if a person has been infected and you are the person who is accountable to take care of them, first of all, put them in an isolated room. Then, do not leave them alone. Don't dump them. That's what I mean. Take care of them, love them, provide them the love, not hanging around with them most of the time, no, but take care of them as much as possible. Give them the food they need. Make sure they drink a lot of water, fluids such as milk. Also give them fruits, a lot of fruits, because fruits help in boosting your immune so that your immune system can fight the COVID-19 infection. Also, make sure these people eat well. Do not leave them to be hungry. Feed them nicely. Make sure you provide them with a clean environment. Ventilate that room often. Make sure it's clean. Make sure you remove their beddings, clean them, so that they can also feel that, when a person is isolated and that environment is not so conducive, that can lead to depression. So clean that room for them. Make sure that they sleep under clean beddings. You can also give them something that will keep them busy so that they may not feel idle. Maybe if someone is much interested with being in YouTube, provide internet for them. You can even give them movies. Let them be busy with movies, at least, in order to forget that stress that comes along when someone is sick and that person is alone in a room. Something else is, whenever you get into that room and you want to provide for them whatever you came to provide, maybe it's food, maybe it's fruits, make sure that you put your mask on. Even the patient can put the mask on for the purpose of preventing you from contacting the disease when you're talking through exchange of saliva droplets. Also, whenever you touch anything that is from that patient, whether you want to clean their utensils, you want to clean their house, you want to ventilate it, make sure that after you clean your hands thoroughly as much as you can. Don't clean it for 1 minute. Clean and clean and clean, knowing very well that definitely you've been in contact with the infectious agents and you need to wash them off. So clean your hands, clean them and clean them and clean them. And keep yourself also clean. Clean yourself whenever you get into that room. Make sure that there is only one caregiver. Not all the members of the family should be allowed to take care of the patient. Let just one person do it so that it can be easier to manage and to control it from spreading from the patient to the caregiver. Again, you're not supposed to have the immunocompromised diseases, which include diseases such as diabetes, maybe high pressure, something else, HIV infections. They're not supposed to have such immunocompromised diseases. Also, you're not supposed to be at the age of 58 and above. This is because older people and people with immunocompromised diseases are prone, or they are so susceptible in getting the COVID-19. So, like older people, their immune is not well capable of fighting the disease. That's why at least someone below age 58, but of course definitely above 20, those are the people who are supposed to take care of these people, because they are not susceptible to getting the infection easily and their immune system is so strong to fight the infection. These are the kind of medicine that you're supposed to provide to the patient. First of all, you should know that there has not been a prescribed product that we are so sure of that can fight the COVID-19. There is no drug. Whatever the doctors are doing, they are treating the type of symptom that they see. So if you see that a person is coughing, provide them with paracetamol or any drug that can be used to reduce the cough. If that person they are sneezing, or if a person is sneezing, you can also provide them with something that can control the sneeze. Maybe they are sneezing because of an allergy or something, so provide them with something that can treat the sneezing. Also, if they have difficulties in breathing, make sure you help them breathe. Provide them with the inhalers so that they can be able to inhale well. There is something that you should not do. If your house have got antibiotics, you're not allowed to provide antibiotics to the people that are infected with COVID-19. Why? Because the antibiotics are specifically meant to kill bacteria and other parasites, not virus. So when you give a patient the antibiotic, then you'll be creating more damage, because the antibiotic cannot be able to destroy a virus. In fact, the virus will continue multiplying. You can provide your patient with the products that are meant to boost the immune system of a person, such as lemon juice, ginger, garlic, mix them properly and give them, or even some fruits such as grapes, blueberries. These are the kind of fruits that are so important, and they can boost the immune of that person. Within that week, make sure that you check how the patient is doing and take keen of how the symptoms are spreading. If the symptoms are so serious, if this person can literally not breathe, they have the difficulty of breathing is increasing, that means that the virus has infected, has damaged the respiratory organs, and so that's why the person cannot breathe. That's when you can decide to take this person to the hospital. And before you take a person with COVID-19 to the hospital, make sure you alert the people that will handle that person. You might take this person to a hospital, then the person can go to spread the infection to the doctors there, because you never told them that that person is infected with COVID-19. So at least make sure that you've informed the doctors earlier so that they can take the suitable precautions to prevent themselves being contracted with the disease. If you are the person who is going to take this person to the hospital, first of all, avoid using the public means of transport or even taxis or cabs. The best way of taking this person to a hospital is by asking for an ambulance. You can contact the police or even the hospital so that they can send their own ambulance to come for the person. At least these people are so prepared, they know how to handle such a situation, and they can be able to prevent the infection from being spread. So if you are the caregiver, it's possible for you not to be contacted. Don't get tired of cleaning your hands. Don't get tired of boosting your immune. Also, make sure you take whatever measures that you're supposed to take in order to fight this disease. Remember that the disease is not over yet. It's there. It's serious. Please be serious with it too, so that you can be able to overcome each and every challenge that come along with the COVID-19. Remember, the best part of this is be safe and stay alive. So love you guys. Love you so much. Stay tuned always. Like, comment, share widely, and be ready to fight the disease. Bye. Love you. Peace.